Blood disorders. There's many types of blood disorders, but often there's one common history, and that is a thrombosis. It happens gradually as we age. We deposit platelets and calcium and fibrin, and we form these clots along the walls of our blood vessels. And it may just gradually close off that lumen, or a piece of it breaks loose, and we call it an embolus. And it's going to circulate downstream and cause a blockage. Heart attack is an example of a thrombotic blockage, typically, because we have a narrowed vessel, and it just keeps narrowing until there's not enough blood flowing to the heart, and we have tissue death. We may also have what's called a embolic blockage, and that's where I've just described. The vessel's narrowed, the lumen's very narrow, and then all it takes is a fragment of that thrombus to break loose and cause complete blockage. And downstream, the blockage is going to cause death to the muscle tissue. Now, ECG or ECK assesses, you can tell just from an electrical rhythm. Hey, here's a nice picture. There's a plaque forming. You have calcium, the white, and you have blood cells, mostly platelets, and eventually the tissue dies and we get chemicals released from the muscles of the heart like myosin and actin. So a blood test can also tell us something's going on. Stroke is another type of blockage. It can be thrombotic or embolic. Typically the internal carotid artery becomes blocked and part of the brain dies. There is some recovery that is possible with this disorder. Hemorrhagic stroke, not quite so common when we have encephalitis and there's just too much blood in the brain. Neurological exam or computed tomography can tell us more about this. Anemia, there's lots of different types. Anytime there's not enough red blood cells to perfuse tissues with oxygen. Iron-deficient anemia, that's when there's not enough iron, and this is something you tend to inherit. You just don't make enough heme, or you don't produce enough red blood cells, and so you can't distribute oxygen adequately. Pernicious is more of a vitamin deficiency, and this is something you may have due to autoimmunity of your digestive system, or more common, it's inherited. And our bodies just don't absorb folic acid and vitamin B12. And so a lot of multivitamins include small amounts of these vitamins. Hemolytic, heme means blood. Lytic means to burst or break. And so a red blood cell is supposed to live about 120 days. And it may not, due to things such as sickle cell, that is a disease where the cell shape is like crescent, and it just can't deliver oxygen when it's in that shape. Malaria, which is an infectious disease transmitted by mosquitoes, and Erythroblastosis Hemolytic. If you're not sure what this disease is, it's a hemolytic type of anemia that involves the Rh factor on the red blood cells. Each of our blood cells has surface markers, lots of surface markers, not just the Rh, but A or B or none. In this case, if the mom is Rh negative, okay, that means she does not have the surface marker on her blood. But her baby does have the marker. So how could this happen? Well, there has to be a father with Rh, and that's how the fetus got the Rh. Now, usually the first child is safe until the late trimester when it starts kicking around and elbowing the mom, and a little bit of blood will leak out into the mom's circulatory system. But often it's born okay. It's the second child that is immediately hit, because the mom's body is sensitized to recognize Rh, and so it begins forming what are called anti-Rh antibodies that can destroy the fetal blood, and the baby will die. It used to be called the blue baby syndrome. But a solution is anytime a mother, I'll tell you, just anytime the mother's Rh negative, the physician is likely to administer a RhoGAM shot to inactivate the fetal Rh positive factors. And because even if the father says, well, you know, I did a blood test, I'm Rh negative, we're safe, we just don't know for sure. And so the safe thing is to administer that injection. Carbon monoxide poisoning, this is why your home should have a C poisoning detector somewhere close to the floor, because this gas is kind of heavy. And that's why dogs and pets, they tend to be the first ones to get sick and die. It's a colorless, odorless gas, and exhaust of all sorts, and smoke, even some leaky furnaces. The problem is the hemoglobin in our blood would prefer to absorb carbon monoxide if it's available. And so it says, hey, you know, oxygen, I don't need you right now. We got this CO. And so headaches, dizziness, but death as well. So make sure that you do have a carbon monoxide detector. It has a little green light. Make sure that is on and it's low. Put it in a low location in the house. Infectious mono used to be called the kissing disease, but it's really not. It's caused by a DNA herpes virus. It infects our white blood cells, and its result is overproduction of lymphocytes, which are a type of white blood cell. So this virus, this herpes virus, enters the body through the mouth, often when we're, I don't know, 7 years old, 8, 9, and we're doing fine. It attaches to our DNA, and we don't realize it, and it outbreaks later in life. Typically late teen years, because the teenager's not eating right, it's not sleeping enough, always exhausted, partying, whatever, and suddenly it comes down with mono the first or second year of college. It's very typical. A low-grade fever, fatigue, and it's self-limiting. Often it's just something your body has to gradually rid itself of or adjust to. Yellow fever, I have my yellow fever shot. If you go overseas to some countries such as India, Nepal, parts of Africa, you need to take a yellow fever injection because it's transmitted by mosquitoes that will introduce the virus into your bloodstream, which moves into the liver. And here's the bad part. Bile flows in the bloodstream from the liver, and the skin appears jaundicey, sort of yellowish. Late in the disease, there's blood in the stools, and the gums start to bleed. High death rate, 50%. And there's still outbreaks of yellow fever in different parts of the world. Leukemia, think of a leukocyte, right? White blood cell. This is just what we call runaway multiplication of abnormal white blood cells, right? They're not, and this is often a cancerous sort of disease that's in the bone marrow. And what happens is these leukocytes will flow into other parts of the body and set up these satellite tumors, and we call that metastasis. But some people live 30 years with leukemia. So there's a lot of different degrees of this disease. Jaundice is it's sort of a symptom of a liver problem. Now, it could be an underdeveloped liver. Like 70% of all infants have some degree of jaundice. Also, cirrhosis of the liver. So alcoholics eventually are going to develop jaundice. It's caused by the excess amount of bilirubin. Now, bilirubin comes from our body breaking down red blood cells. And the bilirubin is supposed to go into our intestines and the feces. In fact, that's why our feces almost always looks the same color. No matter what we eat, it's always that kind of yellowish brown. That's from bilirubin. But if you have a faulty liver, well, that bilirubin just hangs in the bloodstream and makes your skin look yellow. Septicemia, think of septic infection. Here is when bacteria are in the bloodstream and they're releasing toxins that are going to destroy blood cells. Staphylococcus aureus is just a common skin bacteria, but it produces enzymes that will destroy red blood cells. And a very nasty one is called MRSA. Methicillin-resistant Staphylococcus aureus is the full name, or just Staph aureus. And it's resistant to antibiotics, sometimes called the flesh-eating bacteria. And it's difficult to treat. I don't know what to say except watch out for this one. Yep. Staphylococcus pyogenes. I know that's a long word. I mean, strep is like a chain of bacterial bodies. Coccus. Now, it's going to cause infections of all different parts of the body, but it often lives in the upper respiratory tract. In fact, for most of us, we have a little colony living just in the back of our throat. Kind of hangs there. It may enter the blood through all sorts of infections, or if, let's say you just had some dental work where the gums were the tissue was broken, but also it can just move into the bloodstream in other ways and attack organs or even joints. So a common bacteria can become deadly in some cases. Toxemia. The kidneys have a huge job, and they do it well. But if the kidneys aren't functioning properly, then we have what are called metabolic waste products. That just means all the materials in our bloodstream that the kidneys are supposed to dispose of they're not gotten rid of, and so they're building up in the blood, and so we get anemia. Our bodies don't clot blood properly, and even death. The cause of this is often some sort of kidney disease. Insulin intolerance is a problem. To understand it, though, let's understand how the kidneys are supposed to work, or excuse me, the pancreas. Normally, food is converted into glucose, no matter what you eat, even if it's a hamburger. Much of it's going to be broken down into glucose, and this stimulates the pancreas to produce insulin. And insulin's job is to bind to the surface receptors of our body cells, blood and muscles, and then that allows glucose to be absorbed. It's one of those lock and key mechanisms where glucose cannot just flow into cells. It has to have a key, and the key is insulin. The key unlocks the receptor, and now glucose can flow in there. In insulin intolerance, the cell receptors do not bind to insulin, and so it's that, again, lock and key. If the lock and key doesn't work, then glucose can't be absorbed, and now sugar, which is glucose, the concentration in blood increases, and it can reach toxic levels. It's strange that a sugar could become a toxin, but if the cells are not absorbing it, then what we have is insulin intolerance or insulin resistance, same name. Now, the cause of this is often the pancreas is burned out, and it can no longer produce enough insulin. And that is due, and I'll talk about this shortly, sometimes to body fat. Here we have adipose. One of the problems with adipose, especially abdominal adipose, is it's going to release chemicals that increase the rate of insulin intolerance. And so by having abdominal fat, we increase our likelihood of becoming insulin intolerant, and then we have other problems I'll talk about here. The cells that cannot bind insulin are rapidly absorbing glucose. So the brain often is insulin intolerant, and adipose is insulin intolerant, but other tissues can still absorb glucose. So we have this part of the body functioning and part of it not. It's not a good situation. Eventually, the pancreas, which is part of the endocrine system, is just overworked, especially the beta cells that are producing insulin. They produce less and less, to a point that now we have transitioned into something called diabetes. And now it's a more serious disorder. So for many people with adult onset diabetes, it began with poor diet, eating too much sugar, perhaps being overweight, and the slow kind of domino effect leading to this